Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Morning.
As we have this competition between numbers going up and more people getting vaccinated, there's an imbalance of supply. How does that impact the equation?
Well, what it's telling us is that there are many counties outside of the Chicago area that have way more vaccine than is being used. And this is really shocking in many ways because the vaccines are distributed based on the population. But, you know, a lot of people in Chicago, when they had trouble getting the vaccine, which is easing up, they're traveling all over the state. It's like they call it vaccine tourism. All over the state, there seems to be more doses than can be used. And this is the beginning of this vaccine hesitancy, and it's going to be a big problem.
Talk about this travel ban. I don't think people quite understand. So they're not saying which countries, but 80% of the countries, the U.S. is on the list. You said it was a joke.
Yeah, 80% of the countries are on the list. What they forget to say is that the United States is on everybody else's list. We're the ones that are banned from going to most of those countries. It's like, oh, they're banning us. Why are they banning us? Well, they're banning us because we're one of the highest COVID countries in the world. That's why they're banning us. We're just in with everybody else that's out of control.
And how much are school sports contributing to this problem?
Quite a bit, unfortunately. But if you think about it, even with the masks and stuff, there's just so much physical activity, so much hard breathing and everything that this is just basically an infection waiting to happen.
But they also say, is there a study that says there's a case for no mask wearing outside? How do you feel about that?
Well, I mean, we've been debating this from the beginning. If you are outside, and you're relatively isolated, there's nobody around you, obviously you don't have to wear a mask. However, if you're in a city or town, you're in a downtown area, and you're coming in contact with people, you should be wearing a mask. So nothing has really changed. It's just people don't want to wear a mask. But the recommendations are maintained at mask wearing right now. We are not in the clear. We're at this plateau level that's way too high. It has got to go down. There's no decreasing any of these mitigations at this particular point.
Gotcha.
All right, let's take a look at viewer questions. Regarding the J&J suspension, while this is researched, how is it determined if it's just a coincidence that only women 16 to 48 develop blood clots, or is there something in women's biological makeup that predisposed them to blood clots?
Yeah, no, it's the latter part is the truth. So this is a very strange blood clot that's happening, and it's a well-known entity. It's very rare, but it's well-known, and it is associated with women, with women on birth control pills, with women on estrogen replacement, with women right after they deliver a baby. Other conditions too, though. Certain cancers and other underlying diseases, but a lot of them are women. And when these 6 cases popped up, and they're all women, and they're all younger women, it just made sense to put 2 and 2 together. And now they've actually figured out really what the mechanism is for the most part about these blood clots. It's very tragic, but we're going to find out this week, the full data on this J&J blood clot thing. And we'll talk more about that, I'm sure, when those data are released.
All right, next question. I was wondering about movie theaters. Most are distancing seats, and I assume have better airflow now. Would this be a relatively safe activity if you're fully vaccinated?
Well, this is a great question because, what can fully vaccinated people do now that they couldn't do before? Whatever vaccine you've taken, J&J, Moderna, Pfizer, your risk for severe disease, death, hospitalization, ICU admission is markedly reduced. Now, that doesn't mean you go out there and jump up and down without a mask on, because you can still get infected, and you can get infected with these horrible variants. But you can safely do some of these activities now. It's safer. So it's a better condition. Anything is if you've been vaccinated, and you have to put it into that context.
All right, next question. I'm getting my second vaccine. How soon after can I have a margarita to celebrate?
Well, I think as quickly as possible.
That's science.
It's just good science, Dr. Murphy.
Everybody that gets their second vaccine should get a margarita 2 weeks later as a reward.
Oh, so 2 weeks later, I have to wait 2 weeks after the second shot?
Weeks. You have to get protected. Protected, then you can have the margarita.
All
You
right.
got to wait the 2 weeks.
He has to bring science back
Yeah.
into it. All right.
I know it's a drag, but you got to live with it.
Boy, once this is all over, happy hour with Dr. Murphy might be
Yeah.
kind of fun. Put that on your calendar.
We need some positive incentives.
Yes,
Yeah.
we do.
That is a positive incentive.
Yeah, it is.
All right.
Thanks for being with us.
Thanks,
If you have a
Doctor.
question, you can post it on our Morning News Facebook page. And we'll talk to him again tomorrow. Have a good day.